All right, people, we have BFLY, and I didn't even see this. Today's Sunday, December 7th. This was from Friday, December 5th. They had a decent jump there, 4.9. Actually, their jump, they jumped 6.54% in the after hours, and I am not exactly sure why. Well, here's your, hopefully BFLY is coming on a comeback, because I was trying to see what they did. They had this article here. I don't know, that doesn't do anything. They had the insider buying. So they're being compared to TEM, which those are very different. Two key players poised for significant growth. I do think that. But when you look at TEM, I mean, TEM is established. And what's TEM's revenue down here? Because I'll look at BFLY's. You have TEM is doing decently well. That's well. And then BFLY. BFLY is not looking like that. Wait a sec. There's BFLY. So they have a lot of work to do there. They are gross profit. Their operating income is in the negatives here. All right, but strong buy ratings, and now they're over that. But if I was gonna say the other thing, significant insider buying. I think it could be because it's all abuzz with the significant insider purchase, but he had been purchasing for a few days in a row. We have Larry Robbins, who serves on the board of the portable ultrasound device maker, executed a series of purchases over 3 consecutive days, acquiring more than 1.5 million shares in total. Now that could be something, people. And here's the other one. They had this partnership with Midjourney. That one was from a week ago. This is all the news that's been out since Friday. I'm not really seeing it. You have Geode buys, this guy buys, but then there was also a sell. But then here's this one. So this is from November 28th, and I looked up this Midjourney partnership, okay? And Compass AI, that's their own program that they do. But they announcing a new partnership with Midjourney for its ultrasound on-chip technology, along with the rollout of its next generation Compass AI platform for healthcare providers. So not much at all was said about this, but this is Midjourney's I looked up their revenue. They had seen explosive revenue growth, reaching approximately 500 million. They're private, up from 50 million to 22 in 2022. So I don't know. The company operates with a small, efficient team, around 10 to 40 employees. See, everybody wants to fucking hate on little employees, but if this is for real, at least 300 million annually with only 10 to 40 employees. I don't know how. This is just AI. Never mind. I shouldn't believe anything they tell me. But speaking of never believing anything they tell me, I put a couple of the articles in because I want to know more about the Midjourney. There's not that much being told about this. A new partnership with Midjourney AI, like integrative generative AI capabilities in Butterside for enhanced diagnostic workflows. Okay, the developments are positioned as catalysts for business transformation, driving a sharp rally, 43% in the last month, 91 over the last. But what was the rise at 4 o'clock December 5th is what I would like to know. That I don't see. If anybody does know. And then I was asking it about MBOT, because MBOT is our Liberty robotic system, and for the endovascular surgery systems, right? And they got the Emory Hospital adoption. So adoption is a very big deal, both for children and companies, because it's not only possible, but increasingly likely for BFLY to secure a high-profile partnership with a major healthcare company. That's what I want, people. I want it so bad. Achieve permanent adoption, meaning system-wide integration as core diagnostic tool in leading hospitals networks. Maybe now that I'm wondering, this Midjourney is important because maybe their AI system stuff was not up to snuff. And so now this would be good for them, hopefully. And then you have MBOT. Announced at Emory's University, giving the world's first adopt Liberty endovascular robotic system for routine patient care. This marked a pivotal validation for the single-use robotic platform, enhancing credibility, enabling clinical trials, and likely spurring further hospital integration in vascular procedures. I love it. Unlike early-stage MBOT, BFLY Butterfly IQ probe is already deployed in over 1 million scans across 100 countries with proven adoption in systems like UK NHS and US Veterans Affairs. This scale positions it for permanent embedding where hospitals standardize on IQ for bedside ultrasound, Reliance on bulky cart-based systems. Nobody likes a bulky cart. The Compass AI and Midjourney tie-up potentially for AI See, they're speculating the tie-up was potentially for AI augmented imaging analysis. That sounds like a big deal to me. Mirror MBOT's tech stage, making BFLY attractive to big players seeking AI-infused diagnostics. Recent 2025 development include expanded pilots with major insurers and telehealth firms. People, someday, what if BFLY partnered with HIMSS? But that would be kind of crazy, because then people would be given their own ultrasound machines. I don't even know. That would be for like hypochondriacs would like that. I don't know. We'll see. BFLY has prior collabs, and they're forecasting that a tier 1 partnership, OEMs like GE, could bundle IQ into their ecosystem. Permanent adoption, high, 60 to 70%. Given FDA cleared whole body capabilities and cost efficiency, hospitals like Mayo or Cleveland Clinic could follow Emory leads for MBOT, integrating IQ as a default tool amid rising demand for portable AI point-of-care tech. I hope so. And what do we have MBOT at? Got MBOT at 239. God damn it. I really should have got more MBOT here. I don't know why I didn't. I don't know why I hesitated. Why did I hesitate? And I was at the 185, I started thinking, I think they're swinging back around. Whatever. I have a lot of MBOT, but I would have liked more. I'm very bullish on MBOT, as you can tell. And the other one, Hyperfine. I think Hyperfine is going to be Hyperfine. Indeed. I think AI medicine people this is going to be big. Look at them there. They're riding high. Not today. But they got that grant, $3.7 million grant to advance global brain health. And grants are not loans, so you don't have to pay that back. That is a good one, too. Very much debt. But, so there's certainly time for Hyperfly, but I am confident on this Hyperfly. I think the Hyperfly, I just think they could do it. Look at participate in upcoming Piper Sandler 37th annual healthcare. They also got some award recently. They were recognized as some kind of device of the Hyperfine reports preliminary unaudited third quarter, signaling strong business momentum following the launch of the next generation swoop system. See, that's what they're going to have, the Hyperfine swoop system, referenced in France's largest public hospital procurement body to facilitate nationwide purchases of portable MRI machine. I didn't even see that. People, if that ends up, what? I should get more hyper. If this did happen, that'd be huge. The groundbreaking health technique has that redefining brain imaging with FDA cleared AI-powered MRI system Swoop today announced that its distribution partner, UpCare Europe SAS, has been awarded a national referencing for the Swoop system by Union des Hospitaux Portages, France's leading public healthcare purchasing cooperative. That could be exciting. This award, it's going to say, a framework that facilitates central purchasing 1,500 hospitals and 130 hospital groups across France and French territories with the aim of accelerating the adoption of innovative healthcare technologies. This selection will enable hospitals to acquire Swoop systems without initiating individual tenders, thus supporting streamlined procurement and removing barriers to adoption. I think that's interesting. Very interesting. I would like that a lot. I think that Swoop systems could certainly be a player. There they have them. I think I would get more. I think they could shoot. I don't know. None of this is investment advice. Never mind.